Good afternoon, ladies and gentlemen. My name is Fran Borovečki, and today I'm going to talk about the genomic diagnostics in patients with neurodegenerative diseases. Now, when we talk about neurodegenerative diseases, we talk about the group of disorders which are characterized by degeneration of specific subpopulations of neurons and aggregation of protein aggregates. Now, in a whole range of neurodegenerative diseases, we have found clear genetic background, and these include Parkinson's disease, Huntington's disease, Alzheimer's disease, frontotemporal dementia, dementia with Lewy bodies, spinocerebellar ataxia, and amyotrophic lateral sclerosis. When we talk about genomic and genetic background of neurodegenerative diseases, but also other complex diseases, we pretty much can summarize our current status in the slide you can see here. So basically, we have two ends of the spectrum covered well. So on the right hand, we have Mendelian diseases. So for decades, these have been studied, and we found individual genes which can really cause a disease in Mendelian fashion, but they usually affect small parts of population, so usually individual families, and do not explain the wider genetic background of complex diseases. On the left hand of the spectrum, we have common variants of the genotype. So these have been found mostly using genome-wide association studies. And here we have a lot of genes which affect a large number of individuals, but they convey only a small risk, so usually 1.2 to 1.4 fold. Now, a large part of the genetic background has still not been explained fully. And we believe that this is caused by the rare variants of genotype, which in smaller subsets of the population can cause the disease with higher risk. So how do we find these rare variants? So consensus now is using advanced genomic methods. So these include gene chips, panel sequencing, where you select 10, 20, 100 genes and analyze them at once, or whole exome, whole genome sequencing, where we analyze either all the genes or the entire genomic information in a cell. So we've been using such methods, which are based on the approach of next-generation sequencing for 10 years now in Zagreb. So we started with Illumina G2X, then Illumina MiSeq. Now we have Illumina NextSeq 550, where we can use in a standard fashion the machine to analyze whole exomes in all the patients where we think it's necessary. Together with this, I have to say we're happy that we're able to include quite a few genomic diagnostic tests on the list of tests reimbursed by the Croatian National Health Insurance Fund. So these include genomic panel for epilepsies, which we've been performing for 5 years now, as well as gene chips. Genomic panel for immunodeficiencies has been introduced by another institution, but we've introduced this year also Clincal Exome. So we can analyze 5,000 genes in any patient where we see it fit or necessary, who is referred either by a medical geneticist or a neuropediatrician or a neurologist. And I'm happy to say that all these 5 tests can be performed at the Center for Translational Clinical Research. So how do we do this and what are the results? So this is one example of a genomic panel for neurodegenerative diseases. So we've developed a panel with 125 genes where we've put genes which cause ALS, amyotrophic lateral sclerosis, frontotemporal dementia, Parkinson's and Alzheimer's disease. I'm not going to go into rationale much, but using this approach, analyzing those 125 genes, which can find the most common causes of the genetic mutations which are involved in development of those diseases. So one example, a male born in 1958. He was diagnosed with motor neuron disease. The first symptoms set in 2013 with motor weakness of the lower extremities. Later, there was bulbar affection, breathing difficulties, and positive Babinski. He had positive family history for motor neuron diseases. So, and in one of the brothers who was treated in Sweden, ALS was true and confirmed. So we analyzed him using the genomic panel of 125 genes and found that indeed he had a mutation in the SOD1, so superoxide dismutase 1 gene, which causes amyotrophic lateral sclerosis. So Here you can see the position, the chromosome, the change, the DNA, the protein change, and the genotype. So we were able to find the mutation in this patient which truly caused the disease. Now, of course, we always like to go bigger. So we can also analyze 5,000 genes, and now it's fully reimbursed by our National Health Insurance Fund. So using the so-called Clincal or targeted exome, you can analyze a much wider range of diseases. So this is one example, a patient, female, born in 1978, with spastic paraparesis, ataxia, chronic gastritis, celiac disease, low vitamin B12. She had asthma since she was 13. The symptoms started in 2010 with pain and cramps in the shins. She did a lot of the individual gene analysis, but everything was negative, and brain and spine MRI showed no abnormalities. So we used the analysis of 5,000 genes and found that she had a variant in the receptor-associated protein of the synapse or repsin gene, which causes congenital myasthenic syndrome. So here again, you can see position, change, DNA, protein change, and genotype. So using this approach, we were able to diagnose the disease, which otherwise could have been previously diagnosed in maybe 2 or 3 centers in the world. So we believe that the genomic diagnostics is prerequisite for advancing the medical treatments. For instance, the patient with SOD1 mutation, there are now gene therapies being developed especially for those patients. So getting the right diagnosis is crucial. And by using this approach, we believe we can come to the age of precision medicine to treat the right patient in the right way, at the right time, and with the right drug. So with this, I'd like to thank you, and I'm open to any questions which may arise.